So thank you for the introduction. I appreciate and respect the time and space offered by UTS, Upstream Social Determinants in Nursing Practice, and everyone at the Global Practice Initiative team. I'm here today as a representative and co-facilitator of the Nurse Policy Entrepreneur Cafe. I am currently in the United States, and the other facilitators from its initiation come from Central America and Africa. This case study describes our nurse-led initiative for group mentorship, in which the cafe helps our professional identity to evolve for a health and all policy approach to reform. So thank you for your acknowledgement. And before I begin, I would like to take a moment to set an intention of presence and read another mindful acknowledgement, which has been adopted in part from the Peace and Justice Center that I believe aligns with the compassionate art of nursing and caring science. In the interest of time, I will let you read this all yourselves, and I will read the last point. So our work together is about disrupting and dismantling the oppressive systems deeply interconnected with historical and current violent structures. We acknowledge these systems of oppression impact our lives by creating a hierarchy around the voice, experience, and perspective of who is centered and uplifted. We believe it is essential in all of the work that we do to recognize whose shoulders we are standing on and whose legacy we are fulfilling, to work together to dismantle hierarchy and uplift the voices of those who these systems are made to oppress. So keeping that in mind and considering the reason that we are all here today, we recognize that nurses are first witnesses to the social determinants of health for our patients every day as we provide direct care. Our pedagogy is a holistic approach to care focused on upstream concepts of health promotion and disease prevention. Yet in our traditional practice roles, we meet patients who are already having sick diagnoses and need treatment and plan of care management. The polycrises of the world, inequalities, and broken systems have downstream effects that exacerbate these conditions, as well as our ability in our strained workforce to provide this sick care instead of health care. Politics with a big P and policy with a little p both influence the social conditions that generate health outcomes. This is the premise of Daniel Dawes' book entitled The Political Determinants of Health. Nurses keenly understand that health system strengthening expands beyond traditional direct care roles into cross-sector advocacy and networking within public and private partnerships. Nurses work in multiple spheres of influence to shape health and social policy that addresses problems in healthcare, including the workplace, in government, associations, and interest groups. We know well the determining factors contributing to these compounding issues, but sometimes we lack the knowledge, abilities, and confidence to identify and translate our skills away from the bedside to be able to address them upstream for health in all policy. Nurses have maintained our status as the largest and most trusted profession for decades, yet we're rarely engaged in the process of healthcare policymaking and reform. This gap not only is from a lack of invitation, but also nurses struggle to identify as thought leaders in this arena. The concept of a nurse policy entrepreneur, while practiced for some time, is often overlooked despite the nurse workforce's trustworthiness and size. Becoming engaged as a thought leader and policy influencer is an element of the nurse's professional identity, along with the beauty of the diversity in our individual perspectives, personalities, and leadership styles. If we leave it to other disciplines alone to determine the healthcare policy, reform will be marginalized. We must use our qualities and insights to become known as more than just the most trusted profession, but to be also one of the most influential when it comes to policy. But how do we address these issues? The Nurse Policy Entrepreneur Cafe is a nurse-led initiative which was built upon Parsi's human becoming theory and is facilitated using the World Cafe method. establishing our mission, vision, purpose, and core values in 2022. Our primary objective was to offer a psychologically safe space for structured group mentorship that fosters dialoguing, listening, contemplating, and constructing cycles for meaningful evolution of this identity. Rooted in inclusivity, it is open to all nurses and students at all levels from all settings. We meet in a virtual platform once monthly and exchange innovative ideas to achieve the primary outcome of developing necessary skill sets that are not learned in pre-licensure or entry to practice education. We learn the process of how to effectively approach the issues, not debate our stances on them, and serve as a compendium of resources. As a result, we are better poised to take on roles as full partners in healthcare reform and be articulate, trusted messengers who influence change upstream through policy and practice. Our participants serve as our proof of concept for how this environment supports increased knowledge, skills, abilities, and competence. We invite all participants to share their experiences through presentations and blog posts in a know one, see one, do one modeling that inspires others to shift from discourse to action. We are unaffiliated and unfunded, and we host a website that serves as a compendium for open access resources to get started. It continues as a living project for all to democratically contribute, and nurses can then apply what they learn in their practice setting, specialty, or passion topic. We also disseminate these concepts and resources via journal articles, conference presentations, professional organization forums, social media, YouTube, and a newsletter. Approximately 1 year after initiating the monthly Zoom cafes, our regular participants collaboratively contributed to an abstract for a national nursing conference presentation, which was hosted in the United States that focused on nurses' engagement with policy advocacy. This was the first in-person recognition of interest, and it set off a cascade. When we established a website where we then shared groups of different skill sets to focus on. Identifying nurses who have experience in each of those skill sets led to our monthly cafes evolving into a series of themed blog posts and speaker presentations followed by group discussion. Now we are writing retrospective summaries and an annual report of our most recent evolution. The nursing process is being used, and we seek to survey participants and subscribers to assess what they think will be most beneficial to focus on moving forward and what the best format is for dissemination. This is me presenting at that conference, which set off that cascade. And these are some of the examples of how I have shared my journey in blog posts, as many others have as well. But this is the broader example of an impact that even just one person can have. These are just a few instances from the past year of how I alone have been engaging increasingly in broader areas of policy change as a nurse. And I know that my experiences with the Nurse Policy Entrepreneur Cafe have been integral in facilitating my knowledge, skills, abilities, and confidence to do so, as well as help me grow my identity and network with other nurses. You'll notice the colorful wheel of the United Nations Sustainable Development Goals, which I believe can also serve as a proxy of sorts for the social determinants of health. This living project has organically grown, but there have been minor challenges and lessons learned along the way. Although we had nurses voluntarily join for up to 2 hours on a Saturday, we mostly remained a small group of regular participants early on. There was interest, but limited group contribution to getting started and compiling resources. At first, we used an affinity diagram via a virtual Miro board, but suspected technological barriers to engagement with this. After we began actively recruiting volunteers to share their experiences and disseminating, we saw more interest in participants and added this information to the new website. Because of this, we weren't sure if or how much this was garnering interest or helping nurses. Once we attached analytics to our online presence, we uncovered the interest and global reach. It showed thousands of engagements across all 6 continents. While there have been international participants, there will never be a single time or day where everyone can attend live. So this is why we have posted recordings online and tried to ensure open access and relevancy of all resources shared through various multimedia platforms. We have been approached now by some of these international participants, including other healthcare disciplines, social impact groups, and government workers. And we're now exploring the idea of facilitating others to host global cafes by continuing with our know one, see one, do one modeling approach as we strategically plan for the coming year. So that is my short and sweet presentation of this case study. Thank you so much for your time and interest. I'm honored to have this opportunity to share the cafe with all of you across the regional scope of this symposium, and I hope it offers insights and inspiration. I warmly welcome you to visit our website. I will put the link in the chat, and I welcome you also to make any suggestions or contributions that you would like to it. At the website, you can find the blogs, shared presentation recordings, sign up for a monthly newsletter, and the Zoom link to attend. We meet every second Saturday of the month at 12 noon Eastern Time. Our next one will be next weekend. Feel free to get in touch with us at the email on the screen or me personally via LinkedIn, which I will also share in the chat. And I'm happy to take questions at the end of our session today. Thank you so much.